Hi, everyone. My name is Kate Carmody, and it's a pleasure to be here with you all today. The research that Dr. Sri Banerjee and Dr. Giovanna Sarcino and I conducted is titled Disparities in Chronic Hepatitis B Mortality Outcomes, African Americans and Caucasians. We have no financial disclosure or conflicts of interest with the presented material in the presentation. Here you can see our abstracts, which we will discuss in further detail throughout the presentation. Despite a decline in rates of hepatitis B in the last 3 decades, the virus continues to be a problem among African Americans. Recent attention to racial and ethnic disparities in health outcomes highlights the excess disease mortality for many chronic diseases for African Americans as compared to Caucasians. We investigated whether hepatitis B was similarly associated with the overall mortality in Caucasians and African American men and women.
Thank you, Kate, for providing that wonderful introduction. Now, expanding on what she has stated, it's really important to understand the risk factors that are associated with hepatitis B. Furthermore, I wanted to go into how we were inspired to explore a little bit more into hepatitis B. We found that in Appalachia in the United States, there is a higher preponderance of intravenous drug users. And so drug use is higher, and so naturally there's increased hepatitis B virus infection. So we decided that similarly, if a geographic region can be a source of grouped analysis, why not ethnicity? So we decided that we were going to see if some of the same disparities that are seen in the short term with hepatitis B, with African Americans having more likelihood of mortality, if these trends also persist in chronic hepatitis B infection and the types of long-term outcomes. This slide briefly illustrates the importance of understanding the reasoning behind increased hepatitis B virus prevalence, but also the importance of understanding how uniquely the natural history specifically affects ethnic groups. So in our specific research study, we decided to look into the National Health and Nutrition Examination Survey. This is a nationally representative data set which is collected annually, biannually, and also you have results that are provided through a number of years. So in our study, we focused on the years 1999 and 2010, and then we followed up respondents to December of 2015. We included individuals that had information on the hepatitis core antibody and the surface antigen. So we used Cox regression test to try to understand relationships and trying to understand mortality. This figure clearly demonstrates how the relationship was that we studied. So we first tried to determine if there's a relationship between hepatitis B virus and all-cause mortality. And then we tried to see if race was an effect modifier in this relationship. This is an important slide because in this slide, if you start from the left is the reference category. And then if you look at hepatitis B, those that are positive for hepatitis B, if through chronic infection they have a 3.25 times higher likelihood of mortality than those that do not have hepatitis B. However, when this is stratified by ethnicity, then we see that among African Americans, there is not only a higher mortality, but there is a statistically significant higher mortality. So as it turns out that there is 4.43 times higher mortality among African Americans if they had hepatitis B versus if they did not have hepatitis B. These relationships do not persist among Caucasians.
Thank you, Dr. Banerjee. Here you can see our research conclusion. Our research shows that mortality among individuals living with chronic hepatitis B infection continues to exceed unaffected individuals in a nationally representative sample. It's important to note the correlation of the stigma between IV drug use and the stigma of the disease. Identification of chronic infection, improved surveillance efforts, and addressing issues with health equity are needed to improve survival. And here you can see our research references. Thank you.